Hi, welcome back. Today, here I am with an important topic of discussion for Nclex preparation, that is airway. Airway loses to the circulation. Here, I am going to explain this with the help of a scenario. Let's go. It is a SATA type of question. It says, the nurse is assessing multiple clients in the emergency department. Which client requires immediate nursing intervention? A client with anaphylaxis had mild wheezing but blood pressure is 70/40, and B, a client with pulmonary embolism reporting a sudden chest pain and oxygen saturation of 89%, C, a client with gastrointestinal bleeding who is pale, confused and has a BP of 78/46 mm of Hg, and D, a client with asthma who is wheezing loudly and using accessory muscles, and E, a client post-catheterization with cool leg, an absent pedal pulse and severe pain. So think friends, which would be the correct answer? Yes. Here the right options are A, the client with anaphylaxis who has mild wheezing but blood pressure is on the lower side, that is 70/40, and option C, a client with gastrointestinal bleeding who is pale, confused and has a BP of 78/46, and E, a client with post-cardiac catheterization with cool leg and absent pedal pulse and severe pain. These are the correct options. We can see how this has been chosen as a correct answer is because first option A, anaphylaxis, that is BP is also less and the patient is also having anaphylaxis. This stands priority, and there is a circulatory collapse here and the patient is in shock. Even though the airway symptoms are very mild in this option, the BP shows very less. It indicates the distributed shock and the organs are not perfusing appropriately. Death can occur quickly without epinephrine and fluids. So circulation failure beats the mild airway issues in this problem. Next we can see the option C, why it is correct is GI bleeding and hypotension along with confusion. This goes priority because it indicates the signs of hemorrhagic shock. The red flags here are altered mental status and severe hypotension and active volume loss, which is mentioned in the option. So the brain and the organ perfusion is being already failing. So this stands priority. And next option which we see which is correct is option E, the post-cath no pulse and cool limb, which stands priority because of arterial occlusion, risk for limb death and embolism and circulation emergency. Nclex allows post-procedure complications, why the other patients are not priority. Pulmonary embolism is a normal findings where the saturation of 89 is expected, and serious condition but oxygenation is still under the limits, not showing any collapse or instability in the patient. And option D, the asthma wheezing loudly patient Nclex trap here is loud wheezing means air is still moving, and true impending respiratory failure shows a silent chest or unable to speak or the extreme fatigue. These are not mentioned in the option. So this is not the correct answer. So the Nclex rule which is tested here is shock skills faster than moderate airway compromise. Perfusion to brain and heart is highest priority and it is the highest survival. And loud breathing doesn't mean it is worst breathing, it is normal. It means the air is moving inside the respiratory tract. Killer memory rule, what we can remember is if the blood stops moving, the airway won't matter. So the circulation always stands priority. Thank you friends and happy learning.